Most front desk team only schedule about 3 out of 10 new patients who call in. That's not a marketing problem, it's a phone problem. I went through a $200 course that trained over 2,000 dental receptionists, and I'm breaking down every single tactic that I learned. In this video, we're going to go over proven tactics that you could use to answer tricky questions, overcome objections, and set expectation. So let's get right into it.
Operator push eye, biting into the latest in dental innovation. You're with the operator.
How much do you charge for a crown? This is an example of what a bait question is. Bait questions are any questions that could quickly lead to patient hanging up, and most often it's a question about price. But in most cases, you don't want to give pricing information over the phone, and that's for 2 reasons. First, you can't exactly know the treatment costs until the doctor sees. And second, you have a much better chance of getting the patients to accept the treatment if they've already come in, you built rapport, and the doctor knows exactly how much it's going to cost. Plus, you probably aren't even the cheapest in town, nor do you want to be. These type of questions often come earlier before you even have a chance to learn about the caller, and that's why it could be difficult to handle, and they make it feel as if the caller is in control of the conversation, which I mentioned in part 1, that it could be pretty uncomfortable. So how do you deal with bait questions? Fortunately, there are some magic words you could say to diffuse the conversation and question. If somebody immediately asks you about price or anything you don't want to answer right away, here's what you could say. That's a great question. While I look into that for you, can you tell me a little bit more about why you're calling us? Now, this will allow you to take control of the conversation. So now you're the one asking questions and directing the flow of the conversation instead of having to answer the questions. And more importantly, you're making space for them to share their situation, which they usually will, at which point you'll have started to build trust. And on top of that, you're avoiding having to answer the big question until you've built more rapport with the caller. And if you feel comfortable and you feel that rapport's built, then you could go ahead and say something like, the best way to answer your question about how much the treatment costs is by scheduling an exam with our doctor. This will allow us to assess your specific needs and give you the most accurate price. Most callers will be satisfied with that answer. If a caller pushes you further to give them a specific price, you could try asking them more questions about their conditions to get them to say, I don't know. For example, if the caller is asking you, how much do you charge for an extraction? You should ask them if they're experiencing pain, whether the tooth is impacted, how many roots the tooth has, or if they need a bone graft or not. The caller will most certainly not be able to answer those questions because they haven't had an exam. Once the caller says, oh, I'm not too sure, that's when you could say, that's why I can't give you an accurate price over the phone. We should get you in for an exam right away so we could assess the specific needs. However, if they absolutely insist, then you could give them a wide range of quote and invite them to schedule an exam in order to receive the most accurate price. How do we deal with patients who are worried about price? Many times, we label callers who ask about price as price shoppers. And more often than not, many patient coordinators like to dismiss them. But let's think about that for a moment. By dismissing them off the back, you're losing out on potential patients. And 2, dental treatment is expensive even if you have insurance. If you're going to potentially spend thousands of dollars on something, it's completely irrational to look for the best prices because most of us don't have thousands of dollars just sitting around. Even if you did, we still want to feel like we're getting a good value when spending that money. So what you need to do is start building value. Building value means helping them understand why choosing your practice will help them improve the quality of life. In the last module, we talked about your unique selling proposition, or USP. This is what sets your practice apart from the crowd. Communicating your USP and how treatment could help solve the caller's problem will usually go a long way towards making them feel less concerned about this. Remember, everybody is willing to spend the money if you understand the value that you're getting from it. In sales, there's a technique called dual alternative close. Here's how it works. First, affirm the caller why and show them that you want to help solve the problem. For instance, you might say, I understand you've been struggling with this pain for a while now, and I'd love to help you feel better. The first step is to get you an appointment with our doctor so she could do an exam. And then you could use the dual alternative close. I'd love to get you scheduled right away. What works better for you, this afternoon or tomorrow morning? Rather than asking if the caller wants to schedule, I'm presuming that they already do and giving them two different options that both lead to booking an appointment. You could use whatever options that you want for this dual alternative close, morning, afternoon, Tuesday, Wednesday, this week, next week. The whole point is to give two options that both lead to an appointment. There's one more important thing that I really want to mention here. Always schedule a new patient so that they could come within 72 hours. If you make them wait longer than 2 or 3 days, the odds of them no-showing increases dramatically. Just because a caller scheduled, it doesn't mean that they'll necessarily show up. In fact, for marketing patients, no-show and same-day cancellations run as high as 25%. So once a patient has actually scheduled that first appointment, you want to take a moment to keep building rapport and setting expectations so that they'll actually want to show up. For patients who are coming in for a typical new patient exam, you might say, "Excellent, we're excited to see you on the 14th. First, you'll be with our hygienist for cleaning, and our doctor will do an exam and take some x-rays so that we could see how your teeth are doing." Obviously, you want to adjust this language depending on the situation, but your goal here is to give a patient a little bit more information about what they could expect so that they could feel more confident that they will want to show up. This is also a great opportunity to use your doctor and hygienist's name on the call so the caller could start to think of them as real people. Now, be sure to let them know that your practice will be texting or calling to confirm the appointment and that they need to confirm it in order to keep it. By now, you should definitely be automating the appointment reminders. If you don't have a tool already, I'll leave a few links in the description below. Be sure to check those out. If you made it this far into the video, I know you're waiting to hear an example of the actual phone calls. So here are some examples to help your team understand a good sounding calls from a bad sounding calls.
This is Linda. How may I help you? Hi, Linda. Do you guys do whitening?
Yes, we do.
How much is it?
The in-office is $375.
Is that the only option you have?
We also have a take-home that comes with the trays, and that's $350.
Okay. Thank you so much for your help. I appreciate it.
Okay, would you like to schedule to come in?
Not right now. Thank you.
Okay, thank you. Have a good day.
You too. Bye-bye.
Bye.
Phil, this is Whitney speaking. How may I help you?
Hi, Whitney. My name is. I'm looking for some emergency dental services. I'm trying to get a tooth pulled. It's really giving me a hard time.
Okay. Are you a current patient of our practice?
I am not.
You are not. All right. And you said your name was...
Yes, ma'am.
Perfect. And how did you hear about our office today?
I just looked you up online.
Perfect. And what is a good contact number in case we get disconnected? Perfect. And you said you are looking to get a tooth pulled. Do you know what
Yes.
tooth number that is or the area in your mouth it's located in?
It's I guess it would be the second molar on the bottom left.
Second molar, bottom left. Perfect. And James, do you prefer morning or afternoon appointments?
So I'd like to get it done right now. I mean, I've got work the rest of the week, and I'm afraid
Okay.
that I'm not going to be able to go to work if I don't get it pulled. And
Okay, I understand.
I just left another dentist office around the area that
Okay.
ran my insurance and told me that they don't do same-day treatment for my
Okay.
insurance, so that I would
Yeah.
have to, I just can't wait. I just rather
That's
pay cash
okay.
and go
You
and get
can-
it done.
That's okay. Let me get a few more pieces of information from you, and we'll be happy to see you today because we do offer same-day services. For that extraction, would you be interested in using nitrous or IV sedation? The nitrous is kind of like the laughing gas. It's $35, and it relaxes you.
Okay, but it won't. That's not a numbing agent.
No, sir. So you will be numbed, and then the nitrous is more so for your comfort level.
Okay. Yeah. I mean, I guess nitrous would be fine. Would that be the cheaper way?
Yes, sir. That is $35. The IV sedation is closer to $300, and you would have to complete that having nothing to eat or drink for the 6 hours prior. So that's
Okay.
something we normally schedule for future appointments. But if you're interested in it today, I do suggest the nitrous for you, okay?
Yeah, the nitrous will be fine.
Okay, perfect. And you did say that you have dental insurance. Do you have that information with you?
Yeah, I can get it. It's on my phone. So give me 1 second.
Yeah, no problem.
If you found this video helpful, make sure to like and subscribe. I have a lot more better content coming for front desk team, back office teams, and I'll see you in the next video.